We
Can I
can.
start? Okay. So, hi everybody. I am Dr. Raina Chawla, faculty at Conceptual Obs and Gynae. And today is a very important session because you've all are finishing, coming to the end of your 3-year residency, DNB in Obs and Gynae. And now is the assessment part. What have you learned in these 3 years? Everything is now going to be assessed in the next few days and again in the practical exam later on. So there's a lot of tension, there's a lot of anxiety, and I completely understand that feeling because we've all gone through that those days a long time back for me at least. But I still remember those few days before the exam, how nerve-wracking they can be, how difficult they can be, and how apprehensive you are. I can totally understand. And anyone, I mean, who's a gynecologist now, who's passed the exam, we can all relate. So I'm just here to try and ease the tension, okay, not increase it. So I hope if those of you are listening are taking a break, it's just a small 15-20 minute motivation session I thought I'd take and just tell you or help you out a bit in these last few days, what to expect and how to go about giving the exam and what all is important. So the topic is how to tackle the DNB exam, the tips, topics, and exam day game plan. Now, I am a DNB examiner also. So I have checked papers. I have come as an examiner. So I also know how or where what exactly we're looking for when you write an answer. So I'll take you through that also, what goes on in the examiner's mind. So I've been there both places. I've been on both sides. I have been a student, I've been an examiner, and now I am a guide and mentor. So I can help you out and tell you what is really important. I think all of you know this. The exam format has 4 papers, and the papers include 10 questions is each paper, 10 questions of 10 marks each. The paper one is basic sciences. Paper this is general. Okay, sometimes you might find questions from maybe basic sciences in paper 2 or 3 because there's a bit of overlap, of course. But paper one is usually basic sciences and related topics. Paper two is core obstetrics. Paper three is core gynecology, and paper four is recent advances plus miscellaneous things like contraception usually comes here, neonatology usually comes here, ethics and statistics also comes here. So it's sort of a miscellaneous group of everything left out comes in paper four. Now, apart from it being 10 mark per question, one good thing the DNB has done, because I remember when I was a postgraduate, and I'm talking about 20 years back, um, uh, we always used to hear that DNB is more difficult to pass than MS. DNB is more difficult to hear than pass MS. But now I don't hear that anymore. Okay. So what has happened is because I think people felt that the DNB exam was more tougher, more difficult, the NB has actually made it very, very objective. Even the theory exam, which is supposed to be essay type questions, it's actually quite objective and easy to answer. How have they done that? Because each 10 mark question is subdivided into 2 or 3 or sometimes even 4 parts. So there are subdivisions. And the marks are also given of the subdivisions. Okay, so they'll say probably 1 mark for definition of preeclampsia, then 2 marks for etiology, then 3 marks for prediction. Okay, and then 4 marks for management. So it's very clear cut. So it's very, and why they have done this is to make the exam very objective because DNB centers are there throughout the country. They've done this to make it more objective, more easy for the student, more fair. Okay, and also it's easy for the examiner because we know exactly how to mark and what is the breakup. So it's actually a much easier exam than many other institutes or colleges with MS OBG. And it's easy because the breakup is given, the subdivision is given, you know exactly how much to write based on the breakup. So that makes things quite easy. But what now? We have 3 days left. The exam is from the 25th. We have exactly 3 days left starting tomorrow. What should you do? Okay, in these 3 days, I know that it's very, very, you want to finish so much. You might not have done a few topics. You're worried, okay, should I do that? Should I start revising? What should I do? Where should I start from? First of all, just take a deep breath. Okay, take a deep breath and calm down. Okay, remember, it's just an exam, it's not the end. Okay, and exams will keep coming in your life. Once you clear this, maybe you'll write another exam, maybe you'll give your NEET SS, maybe then you'll have to write your SS exam, clearing exam, then you'll have to maybe want to give MRCOG. So there's so many more exams which are going to happen. Even if you think this is the last exam, it's okay, this is not the end of life, this is just an exam. So that should be there in your mind. Okay, दूसरा important point है, this exam is very easy. Okay, these two things are in your mind. We move on from there. Now, what do you do in these next 3 days? If you've not gone through the previous year papers, it's a good idea to start going through. If you've gone through, start going through again, because a lot of repeat questions come. They may twist or turn the question a bit, but very, very similar questions keep coming. Okay, so you can start going through there, and you can just in your mind read a question, build the framework in your mind. You may not have to write it down, just write the headings, ki subheadings, ki I'm going to write the answer like this. Then check. If you get stuck somewhere, go and read that topic. That will help you with a quick revision. Focus on the high yield. Okay, and we all know what is high yield. For example, rare things mat padho abhi. Don't forget about the rare things. Forget about things which you have never read. If you've never read about, say, when I say rare thing, I probably intersex disorders of sexual differentiation is something which is maybe one question may come, but not more than one question. Something which is rarely asked, and if you've not gone through it, chuck it, forget it. Don't just try to just keep it out of your mind, block your mind. Okay, so concentrate on high yield things which are repeatedly asked. For example, endometriosis, fibroids, AUB, palm coin classification, induction of labor, postpartum hemorrhage. These are things which repeatedly come, and we know they are very, very commonly asked. So common things are common. If a rare thing comes, it's going to be just 10% of your entire 4 papers. Okay, that means maybe one question per paper. Maybe not even that. So chuck that. Okay. Now, this is what you're going to do for the next 4 days. I've broken it up a bit further. We'll come to that. But what should you do in the exam when you're practicing writing in your mind or on a piece of paper in the next few days? Try to subdivide your answers. So don't use dense paragraphs. Okay, as an examiner, when I'm checking the paper, so the DNB has made it very easy. The NB has made it very easy for us also. We check the paper on the computer. Your papers are answer sheets are uploaded on the computer, and we are asked to check the answer sheet on the computer. So, and then we're given a key, an answer key. So whoever makes the question, the examiner who makes the question gives an answer key also to the NB, and we are supposed to match the answer key with your question. Now, answer key mein lambe answers nahi hote. They're not dense paragraphs and long essays. You're just given the buzzwords. Does your answer have these buzzwords? So it's much easier to search for these buzzwords if you've written a structured, organized answer. We're not going to search for buzzwords in a long paragraph. We may miss the buzzwords. Or if you're writing in a paragraph format, highlight your important points using a highlighter, using underlining, using capital letters, bold letters. But it's always better to be in a structured, organized way. So practice in your mind or writing that way. Now, during the paper, we'll be discussing this on the exam day, what is important, but time management is very important. You have to allocate enough minutes per question. Don't get stuck on something for too long, or don't spend so much time on one question that in the end your time is running out and you leave a question which you might have known very well. Okay. In the next 3 days, prioritize your visual memory aids. You might have seen tables, flowcharts, diagrams, algorithms. Try recalling those. Okay, and that is going to help, because this is what really helps in the exams. The more you use these organized, structured answers, the better it is for both the examiner and for you, of course, also. Now, as I'm saying, I've discussed this already, but how do you write the answer? Structure is key. It's very important to define your answer. Although now that the breakup is given of the question, the breakup itself of the question makes you write a structured answer most of the time. But sometimes you may get a long type of essay type of question which doesn't have much of a breakup. Then you have to break it up yourself. Okay, so try to, and this is how we read a chapter. We always have the definition, etiology, clinical features, management includes investigations and treatment, that too stepwise, where possible, guideline based. and then complications, prognosis. So this is how your structure should be, but this is usually how the question also will be broken up. Okay, so you don't have to do too much of an effort, but this is for those questions which don't have a structure. Please break it up, write in numbers or bullets or flowcharts or algorithms or tables and diagrams. This is very, very important. I cannot emphasize enough how important structuring your answer is, because it makes the examiner's work much, much easier. Imagine an examiner who has to go through a long essay and same answer is written in a structured way. What will make my mood better? And to be very honest, it's very taxing checking so many papers. One examiner is given one question to check of all the DNB students of all over India. So you have to literally check hundreds of papers. One question we check. Every examiner is given one question to check. So hundreds of paper, one question. Imagine how my mind would be if the answer is structured versus a long unstructured answer, right? So I would obviously tend to give maybe a little bit more score marks to someone where I can actually easily find the answer in the buzzwords in the answer, the keywords in the answer. Add diagram flowcharts if possible. Keep your 10-mark question within 1.5 to 2 pages. Now, this is a estimate, right? Of course, it depends on the handwriting. It depends on how spaced out you tend to write. Some people write very small, some people write big. But this is just to give you a guesstimate, that try to keep it brief. Don't write lengths and lengths. What's important is not the length of the answer. What's important is how brief or how somehow good a summary you can make of the entire thing. I know there's not much time, but maybe you can practice writing a few. Maybe you have 3 days. Every day, practice writing 3 to 4 questions. So you have an idea, exam, and then you're not thinking how to now form the structure. So practice writing a few questions every day. The last 3 day strategy, starting from tomorrow, what should you do? So this is something which I roughly made, okay, based on what I think would be good. But you can also make it tonight and just write down the next 3 days. Aap kya karoge? What you're going to do? Okay, if you have structure in your mind, you'll tend to follow the timetable. If you have a timetable in mind, you'll tend to follow it. This is just roughly. You don't have to follow this. This is just think what you can do. Like tomorrow, you can what I put is some obstetric topics like labor, finish the entire labor. And when I say finish, it just means you're quickly skimming through the chapter, seeing what's important, seeing PPH, seeing emergencies like shoulder dystocia, cord prolapse, amniotic fluid embolism, just quickly seeing the important things in each chapter, flipping through pages. Where you feel you're not sure of the answer or a topic, they spend some time there. Maybe in the afternoon, you can then move on to gynae, okay, important topics, because you know you won't have much time after every paper to study for the next day. So your time consuming topics are like onco, give it a read once before. Although the paper is after, maybe it will come after says 5, 6 days, but onco is important. At least 2 or 3 questions you can expect from here, and it's a long topic. You might as well finish it in the next 3 days. So gynae and recent advances, I'd want you to have a look tomorrow. Okay. And day after, I would want you to have a look at obstetrics and the paper 1 and paper 2, basically. Tomorrow, have a look at paper 3 and paper 4. Day after, have a look at paper 1 and paper 2. It makes things much easier. You would have that confidence ki chalo, ek baar I have done this. Even if I just get a few hours before the exam, at least I've done this once. Okay, so this is what I would suggest. Tomorrow, do paper 3 and paper 4. Day after, do your basic sciences, okay, and obstetrics. Okay, so include associated obstetric topics. For example, if you're reading physiology of pregnancy, you can finish off so many medical disorders associated. Preeclampsia par liya, diabetes par liya, cardiac disease par liya, anemia par liya, because along with physiology, you know these things go together. Okay, plus anatomy, physiology, these things need to be read because they are important. They will be asked in basic sciences wala paper. So finish that day after tomorrow, closer to the paper. Okay, in the evenings, you can practice writing outlines for 3 random past questions. Now, I had the advantage of this. I had a very good friend. She's now in the UK, Dr. Archana. She and me would sit and study, and we would like devote the entire day studying ourselves. In the night, over coffee or tea, we would sit for hours and we would just discuss whatever, because by evening or by night, we become very panicky. We were in the hostel and we good friends and our wavelengths matched, so we had this habit of studying together. Of course, if you don't have that advantage, then you can practice talking to the wall maybe, or just to yourself, or just writing down what you feel is important, because in the evening and night is when the tension starts building up. In the morning you're fresh, in the evening night you tend to get tense. So try discussing with friends if possible, otherwise with yourself. Okay, go through the diagrams, flow. If nothing works, if you're still so tense, go through the diagrams, flow charts, algorithms, tables. This will really help. Okay. Day three, you need to remain calm. Okay, again, it's going to be like the very, very tension wala filled day. And yes, sometimes it's easy to say ki don't get tense, it's just an exam. It's easy to say, right? But it's not practical. You can't control your mind sometimes. It's very difficult. Okay, you need years and years of practice to control your mind. So what should you do? Skim through what I just said: flow charts, diagrams, definitions, scoring systems. If you've made notes, just go through your notes, just flip through. If you still are unable to concentrate, practice speed writing. What is speed writing? Just practice copying from your notes or writing an answer. And this helps warm up both your hands and your brain. Okay, it helps you focus. And that's very important, that you should not lose your focus, especially one day before the exam. In the afternoon, stay light, avoid heavy reading, revise basic sciences, pack your essentials. Don't forget this: your admit card, your pens, your water, your watch. Okay, remain hydrated throughout the day. Eat clean. You don't want to end up with a stomach bug just before the exam. And talk to someone who makes you feel good. Okay, so don't talk to someone who makes you get more anxious. Speak to a family member, friend, a colleague, a husband, a wife, someone who makes you feel good. Okay. Um, uh, Close your books by 8 p.m. That's the last I would expect you to. Don't, I mean, it's again difficult to put into practice. Your mind will be thinking, Acha, wo bhi reh gaya, I should read this, I should read that. But try to sleep, get enough sleep. Okay, visualize walking into the exam hall with calm. Okay, whatever you think of, whatever you manifest in your mind happens. Okay, so try to manifest good things, try to think of calm things, and try to be fresh in the morning, get enough sleep. That's very important. We keep stressing this. I know it's not easy. Your mind will be running through 1,000 things, but it's important that this is kept into kept in mind. Now, on the exam day, what should you do? You should read the full paper in the first 10 minutes. So, you're in the exam hall, been given the exam paper. पहले 10 मिनट में क्या करना है? Read the full paper. Okay, read the full paper, get an idea. Your mind will start working. Okay, be calm. And once you have the paper in mind, you start prioritizing the questions you know well. Okay, first write, revise later. Allocate time per question. Don't over elaborate one at the cost of others. If you're stuck, if you can't recall something, if you don't know the topic at all, if you don't know what to write, leave that for later. Okay, stay calm. That's most important. Do you know more than you think? If you don't know an answer, think what you would do in routine day-to-day clinical work. Remember, the exam is all about, it's assessing your knowledge, yes. Okay. And most of the time, you would have encountered this situation sometime in the past 3 years. You may not know the perfect answer, but it's important to try and recall from day-to-day practice what you know best and what you can write, so that at least you don't end up with a blank answer, even if you don't know. Okay. And when you start writing, things start coming automatically. Okay. So time is important, time allocation. Don't get panicked is important. Don't over elaborate your answer. Stick to the time limit. If you're stuck, leave space, come back again. Okay. So this is how it should be done. Again, same thing I'm repeating again. Write in bullet points, use headings, structure your answer, diagrams. I'm telling you, will get you bonus marks. Where possible, draw. Where possible, write a table, a flow chart, a summary. I told you per 10 marker question, that means per question, don't exceed 2 pages. It's very taxing for the examiner to read. And this is again, I'm telling you a rough guesstimate. It depends on how your handwriting is. Don't panic if you forget. Write what you know, write what you know, and write it very, very confidently. Okay, so it's not a difficult exam, it's an easy exam, and that's what you need to understand. So confidence is key. You won't know everything. That's a guarantee. The question paper is made in such a way that 80% you would know. Okay, 20% you're going to get stuck. Even I can get stuck. There's some answers when I was writing the books for the previous master solutions. There were some answers I really had to refer to and rack my brain and think is mein kya likhe. Because 20% the exam is supposed to be made difficult, and that's how any exam is made. This is the 80-20 rule. 80% is easy or moderate to easy, and 20% is going to be tough. So forget the 20%. आपको नहीं आता, किसी को नहीं आता. It doesn't matter. But you need your passing marks, right? So what you know, you write well. Confidence over completeness, structure over story. This is most important. Okay, your confidence over completing those rare 20% which you don't know, and structure over writing a long story. So you've studied everything. You just have to write how a DNB examiner will expect. And very important, sleep, at least sleep. I'm going on repeating this. Try to get enough sleep right before the exam, because the next 4 days, I mean 3 days, uh, are just going to go by like that, and you will not get sleep. So the first night before the first paper, try to get in your sleep. After that, it's going to be one roller coaster ride. Okay, till the exams are over, it's just gonna go like this. By the last paper, you will be really exhausted. So give sleep, allow your body to rest before the first paper at least. All right. Now, just there were some topics which the students had requested me in conceptual OBG ki ma'am, these are some previous year topics. Please go through them once. So I just put in, and this was the list I got. These are from the fourth paper, the recent advances, one where a lot of newer things, recent things, odd things come. Okay, and I just put them together because if you don't know what to write, at least you can just try structuring your answer. For example, selective fetal reduction versus selective fetal termination. What is selective fetal reduction? You're reducing the number of babies. So where you're making quadruplets to triplets, or triplets to twins, or twins to a singleton pregnancy. Why do we do this? We want to improve fetal outcome. Multiple pregnancies are a high risk pregnancy. So you want to reduce the risk of preterm labor, fetal growth restriction. Okay, so this is a thing. If you don't know what to write, you can of course understand that it makes sense, right? Selective fetal reduction, maybe we need to reduce the number of fetuses. When is it done? Preferably in the end of the first trimester. Once you're done with your Down syndrome screening, once you're done with looking at basic gross structural anomalies, you know which fetus to terminate is usually the smallest fetus, is where KCL is injected, and counseling is very important. Whereas selective fetal termination is done when there is an anomaly in one fetus, or the one fetus is non-viable, has a lethal anomaly, is non-viable. The aim is to save the unaffected co-fetus, and this can be done depending on the gestational age. If it's early trimester, again KCL, later on radiofrequency ablation or laser reduction can be done. And this is usually performed in monochorionic diamniotic twins. Suppose you get a question on this and you don't know. So you have some idea, you can think over it, spend a few minutes, think what you need to write and structure your answer. This is a commonly asked question, but I got asked this: what is inverted pyramid of antenatal care? Okay, now this is an example of a question where a diagram is going to get you full marks. Okay, what was the old concept was the pyramid of antenatal care, where maximum focus you can see is in the third trimester, very few visits in the first trimester. So the pyramid of care was based on the number of visits. Less visits in the first trimester, more visits in the third trimester. We still follow this, but we have turned the triangle upside down. It's called the inverted pyramid of care, where it's not based on number of visits, it's based on your prediction and risk scoring. So at the 12 weeks visit becomes the most important, because here you're screening for aneuploidies, you're screening for preeclampsia, you're screening for IUGR, you're screening for, you're looking at cervical length, you're looking at chorionicity in twin pregnancy, so many things you're looking for. And you are then dividing the patient into specialist care, whether she requires specialist, or high risk care, whether she's low risk. So this inverted pyramid of care is the new model, and this helps prioritize or risk classify your patient in the first trimester itself. So this is what it is. And if you draw this diagram, you got full marks. You don't have to write a long essay in this. You just have to show this diagram and you get your full marks. So this is an example of a question where a diagram is very important. Now, there's another question on labor analgesia. This is a question where you can put it in a tabular format. Okay, just to show you. So labor analgesia, you can write labor analgesia as non. Again, if you don't know the answer, think of what do you do? How do you give pain relief in routine labor room posting? What have you done? Many places we will not have facilities, but we tell the patient, we give them massages, or we ask them to take deep breaths. So breathing techniques are there. If you follow the Western culture, you have things like hypnobirthing. TENS is now coming up in our country also. Continuous labor support, make sure somebody's there. That itself will calm the patient because it gives psychological support. Then things like hydrotherapy. This is a separate question in itself, which I have discussed later on. Then you have opioids, then you have inhalational agents. You just divide your answer. And then you have, of course, epidural. When you think of labor analgesia, immediately mind mein aata hai epidural, right? But remember, labor analgesia has a lot of other aspects too. So you have to write the advantages, disadvantages of non-pharmacological, opioids, inhalational, etonox, regional, which is the gold standard, of course. And you can even put in local anesthesia, like if you're in the second stage of labor also. So labor analgesia, it's not specified, no, first trimester, first stage of labor, second stage of labor. You can even add in pudendal nerve block or local anesthesia when you're giving an episiotomy. That also will complete your answer. So this is a good example where you can put everything in a tabular or a table format. Now, this is something which is new, which you may not have read about, maybe seen in movies, right? And because it's not practiced commonly in India, very few places are offering this water birth. So if you don't know what to write, this is a question which is a good example of you don't know what to write in this. So water birth, what is it? The name itself tells you, no, well, the woman is delivering in a tub of warm water, and this includes two parts. It actually includes water labor only, where only labor wala part is in the water. Second stage where the patient is brought out, and then you have complete water birth where the delivery also is taking place in the water. What is the rationale behind it? Warm water will relax the woman, okay, both mentally and physically. It reduces pain perception. Buoyancy supports maternal positioning and pelvic opening. And it some people believe that it stimulates intrauterine. The baby is in a liquid media. It's coming from one liquid media and entering another. So sort of a psychological impact. Many parents feel that it's easier for the baby to transition. Then you can make a separate column. So this is you don't know what to write in this question. So these are just points to tell you, help you think. You in your mind thinking, who will you allow? Will you allow a high risk patient? No. Will you allow a low risk patient? Yes. So low risk singleton pregnancies, cephalic presentation, term, spontaneous onset of labor, average fetal weight, informed and motivated mother. And contraindication means any high risk patient. Preterm you will not allow. High risk, sorry, this would be high risk. This is my bad. Multiple pregnancy you will not allow. If she's, again, my bad. This is induced labor if she is, okay, I think the same table has got copied here. This is the contraindications were actually the opposite. So my bad here, but contraindications are the opposite. So preterm, previous cesarean, VBACs, all that you will not allow in a water birth for such patients. So your answer becomes very straightforward now, right? Even if you knew nothing about it. Some additional thing, you have to maintain asepsis. It should be easily accessible. Trained birth attendant should be there. Emergency setup should be ready if required. You should be able to monitor the fetus in water. You have waterproof CTG monitors which come. So that all you can also add additionally. Then complications also you can mention maternal fetal you're worried about fetal distress, right? And immediate resuscitation may not be possible. The baby may aspirate water. It's these things which are things which automatically you will think of. Maternal, maybe there's a tear or there's PPH or there's retained placenta. It's difficult to take care of that in the water. So managing third stage complications become difficult. Giving an episiotomy becomes difficult. So those things you can mention. Just to add on, this you may not know, of course, but this you can add. It is not widely practiced in India due to setup constraints. And even RCG and ACG who support water immersion during labor, but urge caution for underwater delivery due to insufficient evidence. Now, this is another question, recurrent endometriosis. So, you know the management of endometriosis. How has the question come now? Management of recurrent endometriosis. What is recurrent endometriosis? Is when endometriosis recurs within 5 years of previous treatment. Okay, now, what do you write in such a question? You just have to write the treatment of endometriosis. Just because it's recurrent does not change it much. Okay, so this is again another example of if you don't know what to write, how do you write the answer? So, in recurrent endometriosis, why does it happen? Probably incomplete excision was done. Maybe an endometrioma has ruptured and endometriotic debris have gone and spread in the peritoneal cavity. Maybe there's an ongoing estrogenic stimulation, no post-op suppression was given. Maybe she's had surgery at a younger age, maybe surgery was incomplete and some spots were left behind, or maybe she had deep infiltrating endometriosis where achieving a complete resection itself is difficult. So more residual disease was there in the first place. Right. So what are the treatment options? So same thing. How we have in treatment of endometriosis, same thing. Expectant, medical, surgical. So it's nothing new. It's just a different way of asking management of endometriosis. Okay, some things you can mention is that you will prefer excision over ablation in surgical management and cystectomy over drainage or marsupialization, de-roofing of an endometrioma. So better you have to remove the entire cyst. Consider robotic or laparoscopic. This gives a better result than open surgery, and definitive surgery should be mentioned. So just use a bit of your just needs a bit of thinking, right? And thinking, how do I write this answer? How do I frame it differently from just management of endometriosis? All right. Now, someone asked me, "Okay, ma'am, what do we write in this question? If a question comes on vaginismus." Now, vaginismus, I'm not sure how often as a resident you encounter this, but I encounter this very, very, very commonly in daily practice. And now because awareness is more and more women are coming. So this I just put together from my routine practice, because you will not find this topic specifically given in any book. Some of the infertility books will give it. Routine books में नहीं होता है. So what will you write? So it's basically involuntary contraction of the vaginal muscles during attempted penetration. Okay, this I definitely did search. It comes under a specific group of disorders called as genitopelvic pain penetration disorder. The etiology is usually psychological. Many times there's a history of sexual abuse or in upbringing. There's a lot of anxiety. Today I had a patient who came with vaginismus and she is delivered twice, and she's just so frightened of a penetrative intercourse now. Why? Because if you go back in the history, she's been so traumatized by her delivery where the nurse or a person in the labor room kept repeatedly doing PVs, and it was very hurtful, and she felt they were very unnecessary. So repeated PVs were done, some 10, 12 PVs, and she's like, it was so traumatic. She avoids sex now because of that. So there's a lot of trauma, anxiety, sexual abuse, upbringing is what is usually the etiology. Management, most of the times counseling, behavioral therapy, vaginal dilators, we teach them how to use them. Physiotherapy helps a lot in this. Use of lubricants or local anesthetic agents also help. So this is a topic again where if you don't know what to write, you can, from what you know, the little bit knowledge that you do have, that you may have encountered, especially if you work in an infertility setup, you would have encountered this more often, but you can write an answer. Okay, so similarly, fertility preserving surgeries, what do you write in this? A question comes, and this question has come in many of the recent advances. What do you write in fertility preserving surgeries? So this is where your goal is to preserve reproductive function, okay? And if it's in related to oncology, achieve oncological or disease control without radical removal, minimize the morbidity and psychological impact. So we usually think of fertility preserving with respect to cancers, but it is also relevant to benign conditions like myomectomy is a fertility preserving surgery, endometrioma cystectomy, not removing the entire ovary, doing a cystectomy is a fertility preserving, adhesiolysis, tuboplasty, these are actually all fertility preserving surgeries, what we operate in infertility, the surgeries we do in infertility. And of course, we usually refer to malignant conditions, radical in cervical cancer, radical trachelectomy, in ovarian cancer, stage 1, early diseases, fertility sparing, oophorectomies, in very early stage endometrial cancer, progestin therapies is what is given, है ना? Congenital anomalies also like metroplasty, septal resections, cervical cerclages, these are all fertility preserving. And in iatrogenic, suppose the patient is due for radiotherapy, then ovarian transposition. If due for chemotherapy, ovarian tissue cryopreservation, you can mention about these things. Again, something which you can put in a tabular format. That's what I put. So this is just to give you some ideas, quick in 10 minutes, how to answer questions which you may not have much idea because these are not commonly asked. So don't get stumped. Just spend 2-3 minutes of thinking and you'd be able to answer them easily. Again, remember, this exam does not define your worth. It is just a checkpoint, not your final destination. Okay, so you've studied for 3 years, you've studied tired, you've operated hungry, you've worked through night shifts, you've done it all, है ना? So don't let this exam determine your worth. Your worth is what you've actually done in this, and I know you've worked really, really hard in these 3 years. So that's your worth. This exam is not your worth, but yes, there has to be a way to assess, and the way of assessment has to be uniform, and that's how life is, that's how things work. So an assessment is necessary, but remember the real work you've worked in the 3 years, you've done a lot of impossible things which normal people would not have done, and this is true especially for gynecology, I think more than other departments, not to put other departments down, but I think gynecologists have seen it all, both mental and physical. Right. So we know what we've done, and that is your true worth. Nobody tells you who you are. The exam does not define you, but just now you have to put pen to paper and let it show. So don't stress out. This is your um, uh, this is I mean this these next 4 days of the exam are not what defines you, but yes, you have to give this exam. It's just a stepping stone in life. So I'll see you on the other side. Once the exam is over, do let me know how the exam went. So all the very, very best, everyone. Please, my most important take-home message is get enough sleep before the first day's paper. That's most important. So good night. Thank you. I hope I didn't take too much of your time. Good night, everyone. Thank you.